for having me. You are really smart, so I don't think that you married up. I do want to say, though, that I'm actually really glad that you mentioned about my brain is still waking up. I had an extremely long day at work yesterday, so forgive me if I stumble here and there. That you mentioned pastors being at the bottom of the food chain when it comes to support, because I know that you said, I knew what you meant when you said it, but I jumped in there and corrected that only because I think it's important. That point is significantly important, is that many times pastors don't get their needs met when they really need it. And it's not out of the fact that people don't care, it's out of that there's so much pressure to have to make sure that you're taking care of everybody else. And I know as a psychologist, I kind of deal with the same thing. I'm actually in the process. Hi Rob, it's nice to see you. I'm actually in the process of applying to a clinic up in Scotts Valley. And one of the questions that came up was, well, how do you take care of yourself? And so I'm kind of talking a little bit differently than what I intended on talking about, but let me just take a side note here for a second. When I was praying this morning, because I have like a whole bunch of material, and I was like, there's no way that I'm going to get through this in 20 minutes. It's just not going to happen. So I was praying this morning, I was asking the Lord, like, what do you guys need? And what I really sensed is that you needed to be encouraged. Like, this isn't just about how do you help other people, but how do you help yourself while you're helping other people? Does that make sense? And so going back to the question about them asking me, well, how do you take care of your needs? And the first answer I give, because it's just totally who I am, is I don't think about my work when I'm not at work. I have really good boundaries, and I've had to learn how to have really good boundaries, and sometimes it doesn't sit well at home, because we were just joking at the table. My husband, for those of you that know him, is super gregarious and very much an external processor. And there's nothing wrong with that at all. It's just how he's wired. But I'm very much an introvert. And which doesn't mean that I don't like to be social. I'm very social. As you can tell, I don't have a problem being in front of a group of people, right? Like in the early days when I would go and talk in front of the police department at San Jose PD, like I was like, yeah, come on guys, I feel like I was part of the team. So I love that kind of stuff. Like I love teaching and being in front of a room, but I recharge by being by myself. And we learned that early on in our marriage, and that became something that we really had to pay attention to. And I think that pastors really need to pay attention to that too. It's like, how do you recharge? Like, what works for you? What do you need to do in order to take care of yourself so that you can pull back, so that you can take care of your own needs? Because if you're not taking care of your own needs, you're not going to be able to take care of anybody else, right? I mean, and I know that we all hear that phrase. I mean, it's the metaphor that gets used all the time about if you're on an airplane, you need to take the air mask and put it on yourself first before you put it on your child. But it's a good metaphor because it's absolutely true. And I just really want to encourage all of you that, we're all in the helping profession. You're teaching people about Jesus. By the way, so do I. I have lots of patients that come in and they want a Christian counselor, and somehow God puts them in my office, right? So I have lots of people that I pray with during sessions. And it's important for you to be aware of what do you need in order to take care of yourself. Because being a pastor is a high-stress job. And it's probably not intended to be that way, but it is. Like, you guys have a lot of pressure on you, just like I have a lot of pressure on me to make sure that I do what I need to do to take care of people, make sure that they're safe, make sure they're not hurting themselves, make sure that they're living the best lives that they can, right? So, Jesus said that he came to give us life to the full, and I fully believe that. And I think that in my perspective, that's like the main thing that we need to be doing as pastors, as mental health counselors. And the other thing that I fully believe in, and this is one of the things I also shared in this job interview, is that I believe that our job is to give people hope. And whatever means that you need to do in order to give somebody hope, that's what you do. And, I really believe that when people can have a glimmer of hope, especially if they're feeling suicidal or homicidal, if you can bring them to that place, then that's what's going to propel them forward. That's what's going to help them to make a different decision. But lots of times people aren't willing to talk about what's going on, because especially people that feel like they should have it all together. So you guys know what I'm talking about. Suicide and homicide isn't just for people that are the ones that we know are struggling with mental health. Many times it's for people that really on the outside look like they have it all together, but on the inside, like maybe there's just too much going on in their life and they're having too difficult of a time. So we need to pay attention to those kinds of warning signs about, reach out to a colleague, reach out to other pastor, reach out to people that are on your ministry teams that are doing a lot. Say, hey, how are you doing? How are you taking care of yourself? Like, I put this post-it on my husband's bedside a few weeks ago, and all I wrote is, what do you need today? And it's just a prompt to check in about what is it that you need today. And we all should be doing that. When you're in the business of taking care of people, we all should be checking in about what is it that you need. Okay, because that's vitally important. So anyway, I went off on a tangent that I did not expect to go, but that's okay. I have a lot of information, and what I'm going to do is I'm going to probably just kind of follow the leading of the Lord here and give you what I think might be helpful, and I'm going to also open up for questions at the end. If there's I also have some information that I can tell you that I have, and if you're interested in it, like Jeremy, like I have some information on like college, college variables related to suicidal behavior. I'm willing to share that information with you guys. When I was asked to do this, we have to do our CMEs, our continuing medical education every year, and so I actually had to do it, and I just did it, and I found a whole packet of information that you guys might be interested in, so I'm going to pass it along to you. So the purpose really of today is to not talk about, like, I don't really always feel like it's helpful to go rehash situations that have already happened. I think that it's really more about how do we give you guys hope about that you actually can do something about it. Like, you actually have a part to play in figuring out how to keep people safe, as well as protecting people around you. Just to briefly touch upon homicide, that I think the thing with homicide to be aware of is that if you are talking to somebody and you have any suspicion, or your gut is telling you something doesn't feel right about this, learn to trust your gut, by the way. It's really important. Just know that it's okay to call the police. Know that the police will always do a welfare check. Know that, as pastors, just like me as a psychologist, you have a duty to warn, and you're also mandated reporters. So if you feel like there is potentially someone at risk, do not get caught up, and please hear this, and hear where my heart is with this, do not get caught up in the drama about, well, oh no, am I going to hurt somebody's feelings? Does that make sense? You need to do whatever you feel like you need to do to just make the move forward and say, all right, so something feels a little off with me about this. I'm not quite sure about it, but I wanted to see if I can have somebody follow up on this. The other thing is too is that, when you call the police, you can be confidential. And the same is true as when you call CPS. Like, if you feel like there's a situation in your church where, a child something needs to be addressed, but you're like, it's going to create huge problems if they know who I am, you can be a reporter that can remain confidential. I just want to throw that out there to you. Okay, side note, I don't know why I told you that, but maybe you guys, maybe someone here, like, that's going to speak to you. So don't ever feel like you are the only holder of a piece of information. If it's something that you feel like I can't do this alone, then go ahead and ask the professionals to help you with that. Homicidal behavior is, it's a really hard one to predict, because people that are intent on killing somebody most often aren't going to tell you that, unless they're enraged. Then you're going to hear all about it. And then usually if they're enraged and you're hearing all about it, if you can talk them down, you usually can get people to, I shouldn't say usually, you sometimes can get people to a pretty safe spot. So know that the best strategy for people, and you all probably know this, is to listen. Okay? The same goes for suicidal behavior, but I'll talk a little bit about that later, about specifically how to listen and how to approach people when it comes to suicidal ideation. But like Brandon said, I'm not going to focus on homicide today. That's like a whole other topic. So the first thing that I want to do is I want to just differentiate the difference between suicidal ideation, which means having suicidal thoughts, and then suicidal intent, and then wishing you were dead or that you could disappear. I have evaluated probably hundreds of people for 5150, which is an involuntary hold for psychiatric hospitalization. But I will tell you that most often when people come in And because we screen them every single time they come in for an appointment, you know, and most often when people come in, there's a box that they can check that says that they have thoughts that they'd be better off dead, or of wishing or of wanting to kill themselves. Most often, when you get really comfortable with screening for things like that, you can say to somebody, I can say to somebody, so I noticed you checked off this box, so are you having thoughts of killing yourself, or is this just really thoughts about just wishing you were dead or that you could escape where you're at? And a lot of people would have a hard time just asking that question, but I'm telling you, it's the best thing to do is to cut to the chase, right? But more often than not, when people are entertaining, like, I just wish I wasn't here, it's not that they're wanting to kill themselves. It's that the pain that they're in is that they wish, like I hear people say all the time, I wish I could just go to sleep and not wake up. Or I wish that I could just go to sleep and fast forward to a week from now and things would be different. Or I wish that a car would just hit me and I would die, but I don't have the guts to kill myself. Like, so that's more often what I hear, if that makes sense. And then usually when somebody is definitely feeling like they want to hurt themselves, they've usually thought through like how that would look. I mean, I've even had people, you know, say, well, I'm suicidal and I'm going to kill myself, but no one would be there to take care of my dog, so I'm going to wait until my dog dies. And they're serious. So it's all about making that mental note. Okay, I need to pay attention to how their dog's doing, right? I say that playfully, but there has to be some lightheartedness in it, otherwise you're going to drive yourself crazy trying to figure out how you're going to manage these people, right? Because they really do need you to be there for them. So suicidal ideation is, and that's a term that gets used a lot, that's basically people having suicidal thoughts. But that isn't the same as intent. Intent is when they actually have an intent to kill themselves, and then the next question is going to be along the line is, well, do you have a plan? Have you thought about how you would do that? And so you're going to drill deeper down into asking those questions. But more often than not, like I said, people have more of a wish that they could just disappear from their circumstances. So just a few facts on prevalence and rates. I'm not going to go into all of this, but I think it might be helpful, is that there's about 30,000 suicides annually in the United States. 1 in 25 people who attempt to actually succeed in killing themselves. That's a lot of people. In 2017, the highest suicide rate was among adults between 45 and 54, which I think is probably most of us in this room. So that's pretty striking when you think about it, because usually when we hear about the news, people tend to focus on like the younger people that kill themselves, and that's important, but there's a whole population of people that actually are walking around carrying these thoughts and these feelings, and a lot of them are the people that we're all ministering to. So be aware that that is the most highly impacted age range. The other one, which actually surprised me, is 85 years old and up. And the reason why that surprised me, because I was even thinking about that last night when I was working on this, is like when I looked at like some of the reasoning why elderly people kill themselves and how they go about doing it and all of that, I was like, wow. Do you know, I've never really paid attention to that, even as a psychologist. But the reason why is because they don't show up in my office, if that makes sense. So they may show up in your church, but they typically don't show up in my office. I mean, I tend to see a lot of elderly people, but I tend to see them more for like depression related to their medical condition or things like that, because I deal with a lot of medical psychology. So that's something to keep in mind as well, is that there will probably a very large percentage of elderly people. The second leading cause of death among youth ages 10 to 24 is suicide. I didn't look up what the first leading cause was. I figured this was enough. Of the elderly, 1 in 4 who attempt to kill themselves is successful. So that's 25% of them are actually successful. And males comprise 83% of them. Okay, so just some statistics to keep in mind. And I'm not throwing these out there as like a wow factor, but as a just for awareness. Like these are the populations that we're actually seeing this issue with. The highest rate of suicide is elderly Caucasian males over 85 years old. So if you were to look at where you see the highest rates, that's where those are up. And they tend to use very deliberate means, meaning like they have it very well planned out, and they make sure that there's no way that someone's going to find out that that's what their plan is. So that's kind of how they go about it. Firearms are the most common method of suicide for youth, regardless of their race or their gender. But I will say that teenage girls tend to overdose. That's what you hear most of with teenagers. Okay? So for youth, most common attempt, but not actually completed suicides, is what I just referred to as females and pills. You hear that a lot. That's very common. And typically completed is a male with a firearm. Okay, we do hear about hangings, but it's usually a male with a firearm. We always ask people, and I have a certain way that I word this, because I know there are people that have firearms, and I don't necessarily think that you have to make the assumption that just because someone has a firearm that they're unsafe, right? So I always ask the question, do you have any weapons or firearms that we need to be concerned about? If somebody is suicidal, okay, let me back up. There are going to be those people that may never tell you that they are, no matter how much you ask them, okay? But most people want help, and most people don't want to die. And most people, if they have a reason to live and you could be there to support them, you're going to help them through that process. So if you were to say to somebody, do you have any weapons or firearms that we need to be concerned about? If they're feeling suicidal and they want your help, they're going to more than likely tell you yes. And then it's basically you just jump in and you say, okay, well, what can we do about that? Do your parents live nearby? Do you have a friend that's a safe? We can just get them out of your house for a short period of time? I mean, you guys can all handle doing things like that. All right, but it's a very important question. One of the #1 things that I want you to walk away from here with is to not be afraid to ask questions. Okay? Don't be afraid to get into the water with them and to say, hey, let's talk about what's going on. Okay? I am going to actually, I realize what time it is, so I'm going to skip forward a bunch. Some basic risk factors that go across all age groups. There's some specific ones to certain age groups, but the ones that go across all age groups are history of depression or other mental health illnesses. Anxiety has actually been shown to actually be more of a predictor of a suicide attempt than depression. And that is because unless you've experienced severe anxiety, a lot of people don't realize that anxiety is a super uncomfortable emotion. Like, people feel very out of control with anxiety because anxiety feels like it's an outside force that's coming in and affecting you. Does that make sense? So people most often feel like it's something they can't control. So when you help them to learn that, well, no, that's actually just you, and let's talk about how you can control that, they feel more empowered, and then they can kind of help to calm them down. But anxiety has actually been shown to increase suicide risk. Hopelessness, substance abuse, certain health conditions, chronic health conditions, chronic pain. People get tired of being in pain all the time. History of self-harm. So every time that there has been, especially for people that have major depressive episodes, with every episode, you run the risk of having another episode. So that's why it's really important for people to be treated. Okay? Recent hospitalizations, especially with kids, research has shown that they're more likely to, if they've attempted suicide, but they were obviously not successful, they're more likely to attempt again within the next 3 months, if the circumstances that caused them to feel the way that they did not change. So there is a period of time in there where we need to get in there and say, okay, what can I do to support you, right? Recent violence or being a victim or perpetrator of violence, and there's also genetic and biological factors. People that come from families where suicide has occurred have a higher risk. And again, these are risk factors. These aren't saying that if these things occur, that it's going to happen for those people, if that makes sense. What it's saying is that you want to be aware of that, and you want to make sure that you're giving them some social support around that. And then it might even be like from a pastoral perspective, it's like saying, hey, you know, so I know that happened with your uncle, but do you know that there are other ways that we can deal with problems, and can I support you around that? Or can I connect you to someone that can? Or, you know, a lot about treating people that are struggling with these issues is really getting into their social cultural environment, which happens to also be the church. So when people feel connected, in a sense of connectedness within their environments, and they know that there are certain people that they can go and talk to, they're less likely to feel stuck and all alone. Because, you know, with kids, especially in adolescence, lots of times what happens is that there's a conflict within their family. And because of the conflict within their family, because they're kids and they don't think like adults. You guys, trust me, adolescents, even up to 18, they do not think like we do yet. Like, there was this joke that we used to have, and it was probably just more mental health humor because it made us feel better, where it was like, you know, adolescents think that they can kill themselves and go to the prom on Friday. Like, but what that really says is that they don't always understand the finality of it. They don't always get that I am reacting to something because I'm feeling pain. So that sometimes their reasoning for doing what they do is because they're hoping to instigate change. They're thinking, and it's not a manipulation. So we need to be careful as adults to like word things as they're being manipulative. Sometimes kids just don't have words. When I say kids, I mean like, you know, even college students. And sometimes people don't know how to communicate what they need and how they feel. So they'll use their actions instead, okay? So yeah, conflict, isolation, family problems, lack of social support, all of those things, financial and work stress, school stress is a big thing for kids. Depending on certain ethnic backgrounds, you can find a lot of stress related to their cultural expectations and what they're supposed to be doing. Okay? You see that a lot in college. You know, a lot of college students, it'll be more issues around, you know, all of a sudden they're thrown into an environment that they're not used to. They feel alone. They're having a hard time adjusting. And you even see this with kids that you think, oh, they would have done fine. Maybe there's the societal pressure of how you're supposed to behave in college, whether it's that you're supposed to be out drinking with your buddies, or whether it's that you're supposed to get straight A's. And a lot of kids just feel a lot of pressure. And lots of times we'll see, side note, the most common age of when like psychotic episodes are first diagnosed is usually in like 18 to 21, 18 to 22, that age range. So lots of times what will happen is that there might have been some underlying mental health issue, and then they pop up when kids are off on their own and they hit college because they don't have their parents around to support them as much. So it's really important to take a look at who you have around, like even for your own families if you have kids, really making sure that your kids have other people to talk to as well. Or kids that you work with within your youth groups, or even adults that you work with within your ministry. I always ask people, who do you talk to for support? Who can you go to? You want to make sure that you're not the only one. For multiple reasons. One, because you don't need that pressure. You can be one of many. And two, they need to make sure that they feel supported by a community of people. Okay? And when they know that there's somebody that they can go to. So for example, like my daughter, I have a 13-year-old. I work really hard at trying to make sure that there's some adults in her life that she knows that I'm okay if she needs to go talk to them. Now we're not there yet. We're super close. Like she tells me that she tells me just about everything, and I believe her. But I also know that, you know, if there is something where she may need somebody to talk to, I don't want to have her be in a position where she hasn't identified a few people that she knows that she can go talk to, and that's cool. Does that make sense? And so it's always good to make sure that people around you have those kinds of resources. Okay, let me see what else I want to touch upon here. The typical profile, I hate to tell all of you this, the typical profile of someone that commits suicide is actually a male, especially 60 and older, single, divorced, or widowed, living alone. So guys, just stay married. Additional risk factors of being Caucasian or Native American. Okay? And the other risk factors that go along with that is lack of social support, decrease in financial status, and associated financial problems. So that's like a big deal. When we have someone come into our office and they're like a male and they're 60 and older, it's like, okay, I need to know, who do you talk to? Who are your supports? I refer people to the church all the time. All the time. I had a woman in my office yesterday who she's super depressed. She lost her job. She hasn't been able to find a job. And I got on the phone and called Cathedral of Faith and was like, tell me, what do you guys do? What do you guys have for food? What do you have there for social support? Can you help her find a job? What can you guys do? And she's right there in my office. And so got all the information. I said, you need to go there. You know, so it's good to know what your resources are, even if it's not your own church. Use each other. If there's another church in your community that has something that you don't have, make some agreements. Yeah, I'm going to send them over to you. There should be nothing wrong with that. It's like it shouldn't all fall on one person, okay? So another thing I wanted to point out about elderly and suicide is that if they have a failed attempt, it was most likely a mistake. That's what research has shown us, that they were pretty set that they were going to kill themselves. So that's something you want to be aware of. I was surprised by that. Sometimes it's doing things like putting their personal affairs in order or giving their items away. Most often they've been to a medical appointment with their doctor within the last month before they killed themselves. And it's usually about really vague concerns. They're probably processing it, trying to figure out what decision that they're trying to make about it. And, you know, and many times it's recent loss of a loved one that kind of prompt them towards that area. Let me see. I commented on that already. On these, and then I'll stop here. Some protective factors that help people to not make that decision is one, social support. Social support is huge. Effective coping and problem-solving skills. If there's any things that you can do in your church that kind of promote some of that, that's great for kids and adults. And it doesn't have to be some heavy thing. Maybe so you do some fun conflict resolution kind of training, something like that, where, you know, I don't know, you guys come up with creative ideas, but those type of skills are great for people. That actually helps to reduce the risk of suicide. Cultural and religious beliefs that discourage suicide and support instincts for self-preservation are really good. Connectedness, so making sure that relationships stay strong. Availability of physical and mental health care, and then reduced access to lethal weapons. I know we already commented on that, but that one is huge. You also want to ask people, well, what keeps them alive? You know, well, and I'm telling you, I pushed the envelope with that one. I have no problem saying to someone, so how do you think your parents would feel if you killed yourself? How do you think your kids would react to that? What do you think it would do to their life? And when they say to me, I think my kids would be better off. They wouldn't have to deal with me and my problems, and you know, they would get my life insurance, and I correct them right there. I was like, well, your life insurance is null and void if you kill yourself, so you just screw them, excuse me, but you just really mess with them economically. And you're going to mess up their life the rest of their life if you kill yourself. Like, I have no problem cutting to the chase with people. Because you have to. Because they're in such a spot that they just aren't thinking that clearly. Okay?